Have you ever had a toothache so bad that the pain seemed to spread into your head and made you wonder, can toothache cause headache? The answer is yes, and it happens more often than people realize. A painful tooth does not always stay in one tiny spot. Sometimes the pain radiates into the jaw, temple, ear, face, or even feels like a full headache. That is what makes this topic so confusing. You may think you have a headache problem when the real source is actually inside your mouth. In this video, we are going to break down who is more likely to experience this, what causes the pain to spread, when a toothache-related headache may be harmless or more serious, where the pain usually travels, why the nerves in the face and jaw can make everything feel connected, and how to know when it is time to stop guessing and see a dentist or doctor. Some people feel a dull pressure. Others get throbbing pain, jaw tightness, or pain that gets worse when chewing. Stay until the end because the last scene covers the red flags you should never ignore. To understand can toothache cause headache, you need to know why pain from the mouth can spread so easily. The short answer is shared nerves. The teeth, gums, jaw, and parts of the face are all connected through nerve pathways, especially the trigeminal nerve system. That means your brain may not always separate the pain neatly. What starts as a tooth problem can feel like temple pain, facial pressure, ear discomfort, or a headache. Where does that happen most often? Usually around the jaw, cheek, temple, and side of the head. Who notices it most? People with deep cavities, cracked teeth, dental infections, grinding, or jaw tension. When can it feel worse? Often when chewing, clenching, lying down, or drinking something very hot or cold. This is also why some people think they have sinus pressure or migraine first, only to later find out the actual issue was dental. The pain is real, but the source is not always obvious. What matters is the pattern. If head pain keeps showing up with tooth sensitivity, chewing pain, or jaw tenderness, the mouth deserves a closer look. TMJ disorders and referred pain can cause headache, earache, and toothache because muscles and nerves in the jaw, head, and neck interact closely. So, what are the most common reasons a toothache and headache show up together? One major cause is tooth decay that reaches deeper layers of the tooth, making the nerve angry and painful. Another is a cracked tooth, which can send sharp pain when you bite and leave lingering ache afterward. Gum infection or a dental abscess is another important cause, especially if the pain is throbbing, severe, and comes with swelling or a bad taste in the mouth. Then there is jaw strain. Some people grind their teeth at night or clench during stress, and that can trigger both tooth pain and headache at the same time. Who should pay close attention? People with repeated sensitivity, swelling, jaw clicking, temple pain, or headaches that seem worse in the morning. When can it be more serious? When the pain is getting worse fast, spreading, or paired with fever or facial swelling. The big takeaway is that not every headache with tooth pain means the same thing. Sometimes the tooth is the main problem. Sometimes the jaw is involved too. Severe toothache often comes from cavities, infection, or other dental conditions that usually need professional treatment. And dental abscesses can cause swelling, fever, and worsening pain. Here is where things get even more interesting. Sometimes people ask, can toothache cause headache, but the real issue may be the jaw joint or the muscles around it. This is called TMJ or TMD-related pain. What does that feel like? Pain around the jaw, ear, temple, or face, sometimes with clicking, popping, tightness, or trouble opening the mouth comfortably. Why does it get mixed up with toothache? Because TMJ pain can create pressure that feels like it is coming from the teeth while also causing headaches around the temples. Where is the pain often strongest? Around the jaw joint, temple, ear area, and nearby teeth. Who tends to get it? People who grind their teeth, clench when stressed, chew gum a lot, or carry tension in the jaw and neck. When does it usually flare up? Often in the morning during stressful weeks or after lots of chewing. This matters because treating a toothache with only pain relief will not solve the real problem if the jaw is the main trigger. TMJ disorders commonly cause headache, neck pain, jaw pain, clicking, and tooth pain that occurs with jaw tenderness. If you are dealing with tooth pain and head pain together, the smartest move is to ask the right 5W1H questions. What does the pain feel like? Throbbing, sharp, pressure-like, or worse with temperature? When does it hit? During chewing at night, first thing in the morning, or all day long? Where is it strongest? One tooth, the jaw, the temple, or across one side of the face? Who might have extra risk? People who grind their teeth, skip dental visits, have recent dental work, or have a history of jaw tension. Why might it be getting worse? Infection, inflammation, cracking, clenching, or delayed treatment can all build over time. And how does your body react? Swelling, bad taste in the mouth, fever, trouble opening your mouth, or worsening pain when you lie down? Those clues matter a lot. A simple symptom note can help you explain the pattern clearly if you see a dentist. This is especially useful when the pain comes and goes and you are not sure whether the tooth, jaw, or both are involved. Severe toothache, fever, earache, or pain when opening the mouth wide are all reasons to seek care rather than just wait it out. This is the part everyone needs to hear. A toothache with headache can sometimes be more than just annoying. When should you worry more? When the pain is severe, rapidly worsening, or comes with facial swelling, fever, a bad taste in the mouth, trouble swallowing, trouble breathing, or difficulty opening the mouth. What could that mean? In some cases, it may point to a dental abscess or a spreading infection, and that is not something to manage casually at home. Who should act quickly? Anyone with swelling in the face or jaw, fever, or pain that is not easing with normal measures. Why is this so important? Because dental abscesses do not go away on their own and can spread to nearby tissues. How should you respond? Contact a dentist urgently, and if there is swelling affecting breathing, swallowing, or severe illness, get emergency help right away. The goal is not to scare people, but to help them recognize the difference between common dental pain and a real warning pattern. Dental abscesses need urgent dental treatment and may cause intense tooth or gum pain, swelling, fever, and difficulty opening the mouth or chewing. So what is the final answer to can toothache cause headache? Yes, it absolutely can. Sometimes the pain spreads through shared nerve pathways. Sometimes the real issue is infection, jaw strain, grinding, or TMJ pain that makes the tooth and the head hurt together. The smartest approach is not to focus on just one symptom. Look at the full pattern. What does it feel like? When does it happen? Where is the pain strongest? Why might it be getting worse? Who may have risk factors like grinding, delayed dental care, or infection? And how is your body reacting overall? Those details can make the difference between a simple dental fix and a problem that needs urgent care. Disclaimer: this video is for educational purposes only and is not a substitute for professional medical or dental advice, diagnosis, or treatment. If you have severe pain, swelling, fever, difficulty opening your mouth, trouble swallowing, or symptoms that are getting worse, seek dental or medical care promptly. If you found this video helpful, subscribe to the channel, leave a comment, and share your experience or suggestions for future health topics. Your feedback helps us create more useful content.